Bob passed away in 2007, and it hasn't always been clear to me what our health policy would have to do with any of that, but as I learned more about what the ACA did, I realized that if the ACA had been passed before Bob died, he likely wouldn't have died. Bob got pancreatitis after having gallstones. He and I were young, just starting out. This is 10 years ago, and we did not have employer-based health coverage. We were purchasing health coverage, and the plan that we were able to purchase was a catastrophic type plan, which we were afraid to use because the plan itself was so expensive that it actually deterred us from getting care. And one of the reasons why this plan was so expensive is because Bob had been denied better coverage because of a pre-existing condition that was acne that he had had as a high schooler. So when we had gotten that letter that the plan that we were eligible for was not going to be affordable for us because of acne, that didn't seem fair at the time, but we bought it anyway because that's the right thing to do, is to buy health insurance. So we bought it. But then when Bob started having stomach aches, we really couldn't afford to both pay for that plan and go to the doctor and have basic things like stomach aches taken care of. So on the advice of his physician, we put that off until an opportune time came, and that ended up being too late for him. What happened was he was having these stomach aches, and when we found out it was just gallstones, the physician said, you can put this off, and when it gets bad enough, you'll come and beg me to take your gallbladder out. And so Bob said, okay, I'll wait. That gallbladder problem developed in pancreatitis, and it claimed his life. He spent 6 weeks in the ICU altogether, 3 weeks here and 3 weeks over in St. Louis, and died of sepsis at the end of that time. This is a really complicated problem, and I feel like this is America. We are a nation of problem solvers. I fear that the healthcare debate, as I see it now, has a lot to do with which political party gets credit for bringing us a better plan. And that, to me, is not as important as knowing that the decisions that I make about this guy's health care are not going to prevent him from having access to care as an adult. I'm hoping that we can come together and do better than we've done in the past. And to me, we cannot do that if we have people managing their care the way that Bob and I had to. Because we need to bring down the cost of everyone's health care, and the only way you can do that is if you have access to care when you need it, not when it's a disaster or a catastrophe or an emergency.